Welcome to the Pediatric Review, where I help you prepare for your pediatric nursing exams. If you would like a copy of the study guide, you can find it on my website, blossomwithjessica.com. Let's talk about pediatric inflammatory disorders. So the first thing we're going to talk about is rheumatic fever. So this is an inflammatory autoimmune disease affecting connective tissue of the heart, joints, skin, blood vessels, and central nervous system. The most serious complication is rheumatic heart disease. This rheumatic fever occurs 2 to 6 weeks after untreated streptococcal infection of the upper respiratory tract. Signs and symptoms are chorea, which is involuntary movements of extremities and face, fever, carditis, inflammation of the mitral valve, elevated ESR, C-reactive protein, which is often seen in autoimmune diseases. They may have abdominal pain, erythema marginitatum, which are red lesions on the trunk, Aschoff bodies, which are lesions found in the heart, blood vessels, brain, and joints, subcutaneous nodules, and polyarthritis. Our nursing interventions are to ask about a recent sore throat because we know that this occurs 2 to 6 weeks after that streptococcal infection. Assess vital signs, bed rest, and limit physical activity, antibiotics, analgesics, anti-inflammatories, seizure precautions if the patient has chorea, which again, those are involuntary movements of the extremities and face. Next, we're going to talk about Kawasaki disease. So this is an acute systemic inflammatory illness. Most serious complication is an aneurysm. Signs and symptoms depends on the stage. So first we have the acute stage. This we're going to see fever, red throat, conjunctal hyperemia, swollen hands with red and enlargement of the cervical lymph nodes. Then the sub-acute stage, we'll start to see cracked lips, peeling of the skin on fingers and toes, joint pain, cardiac manifestations, and thrombocytosis. Then the convalescent stage is when the child will then appear normal. And our nursing interventions for Kawasaki disease are to monitor for fever, assess heart sounds, rate and rhythm, assess for edema, redness, and peeling of the skin, soft food diet, range of motion exercises, and aspirin. Then we have juvenile idiopathic arthritis. This again is an autoimmune inflammatory disease affecting the joints and other tissues. Our nursing interventions are range of motion exercises, medication, and holistic pain relief. If you would like a copy of the study guide, you can find it on my website, blossomwithjessica.com.